Hello, everyone. Thank you for joining today's webinar. I'm Tiferet Frohlinger, Director of Business Development at Freemind. Today, we'll be discussing SBIRs and STTRs at the NIH, at other funders, taking a deep dive into what's in it for you, what's in it for founders, for small businesses, for startups in the life sciences looking to advance their pipeline and their assets through non-dilutive funding. Starting at the very top of what is an SBIR. Let's start with where SBIRs actually come from. It's a congressionally mandated program, which Congress created it back in 1982, and here's how it works. Any federal agency with a large enough extramural research and development budget is legally required to set aside a fixed percentage of that budget specifically to fund small businesses. That's the SBIR mechanism, and its sister program, the STTR, works the same way. Right now, agencies must allocate 3.2% of their extramural R&D budget to SBIR and 0.45% to STTR every single year. So this isn't optional or discretionary. By law, that money has to go to small businesses. As many of you know, SBIR and STTR actually lapsed for a while. The authorization expired and there's no bill in place. But the good news is it's now been reauthorized through 2031. So this is an exciting moment for the industry, and everyone's looking ahead to the upcoming September deadline. So this leads to the first big question of what has changed in the 2026 compared to the previous bill. So first and foremost in the new bill is that it has been extended through 2031. Next is award caps and budgets have increased. So the standard caps are still roughly $300,000 for phase 1 and over $2 million for phase 2. But this year, many institutes have raised those caps significantly for specific priority topics. So depending on your institute and topic area, you may be eligible to request well above the standard caps. We'll go deeply into those exact numbers later in this webinar. There are also new programs and mechanisms. For example, there's a new one called the STTR Direct to Phase 2, and you may have heard of the Breakthrough Award for Phase 2, which is upon award and completion of a prior Phase 2, companies can then apply for a larger Phase 2B Breakthrough Award. So what matters most now is that the January and April deadlines have missed. There's no bill in place. Some companies are asking, will the September deadline be crowded? Is this the right time to submit? And it's true. We'll likely see an increased number of applications, which means two things. One, being strategic and knowing exactly and how and where to submit is key. And two, while it may be more crowded than usual, it's not necessarily going to be 3 deadlines worth in one. The 2026 budget still needs to be appropriated and money allocated to companies. So while there may be more applicants, we do expect the number of awards to go up accordingly. So now let's take a look at how to take a potential idea and turn it into an application. Before starting any application, and this is especially true for SBIRs, the first step is to understand exactly what activities you are looking to fund. I say this because unlike funding mechanisms or other funding company funds you may receive, which come to support the company broadly, with SBIRs, the money is given to fund specific research activities. That's important to understand because you need to convey that message clearly to the funder and find the right funder whose interests align with those specific activities. There are many funders under the SBIR umbrella. Any government program with extramural funds has that mandate to support small businesses. So the DoD has an SBIR program, ARPA-H has an SBIR program, but those have topics that are more narrow. So the main ones we see for small businesses in the life sciences are through the National Science Foundation, NSF, and NIH. So let's take a closer look at the NIH and NSF. The National Science Foundation is interested in different things than the NIH. Sometimes you can present the same idea from different angles depending on which one you're targeting. So the same core technology may be applicable to both. But NSF in general is generally interested in projects that may seem on the surface less innovative, more platform technologies, really focusing on the technology itself. NSF tends to be a good fit for smaller, earlier stage seed companies focused on bringing a technology forward to commercialization. NIH, on the other hand, is driven by its mission, so it's advancing technologies and innovation to help address unmet medical needs and bridge gaps in life sciences. So while that happens through innovation and technologies that are aimed at commercialization, the underlying goal of any NIH-funded project is to promote health. So understanding who you're targeting and shaping your application to that funder is key to being set up for success. With NSF, the process is different. You submitted a project pitch, and upon invitation, you can submit a full proposal. And the next NSF full proposal deadline is November 4th. A project pitch you can submit at any time. NIH will be the core of our conversation today because the pathways there are numerous and less straightforward than the NSF. So let's take a deeper look. The NIH is made up of 27 institutes, each targeting a different disease, a different health area, or an unmet need, and they have their own mission and priorities. So when you're submitting to the NIH, you're really submitting to a specific institute, and based on your project's mission, identifying the right institute matters for 3 reasons. 1, you need to shape your application to answer that institute's specific questions, their missions, and their goals. 2, this year more than ever, the institute will dictate your project's budget, and the budget goes hand in hand with the project. So you need to know this upfront to craft a compelling proposal within those constraints. And 3 is we highly recommend contacting the program officer in advance with your idea because getting their input helps you shape your questions and your proposals before you write a single word. So SBIRs or STTRs, you need to make the choice. Once you've identified your institute, you ask that question. Will you submit an SBIR or an STTR? Both mechanisms have specific budget allocations. A portion goes to the small business and a portion can be outsourced. And that split is the main difference between the two. So if your project involves a nonprofit, a university, a PI as a collaborator, the deciding factor is where will that PI be employed? Because the SBIR eligibility criteria is that the PI needs to be more than 51% employed at the small business at the time of award. So if the PI needs to be based at the university, it will likely be an STTR. But in the majority of cases, most applications are SBIRs. And then the key question becomes deciding between the specific funding mechanism. Within the SBIRs, there are different funding mechanisms. Once you've decided that, you need to figure out which one will give you the highest chances of success. And there are different phases. Phase 1 for earlier stage projects, and that's meant to validate a concept. Phase 2 for projects that have already had a proof of concept and ready to advance towards commercialization. And for that, you need a full commercialization plan to know your market, your revenue stream, know your competitors, have them clearly laid out, and showing the reviewers that the project is going to be market ready. And then a fast track is a combination of phase 1 and phase 2 applications in one. The advantage there is that you don't have a lag from completion and of phase 1 before submitting and waiting for the award of a phase 2. The catch, though, is that you need to have your full phase 2 commercialization plan developed at the earlier stage. So this often fits companies that are pivoting from an asset that is already developed for something, and now it's going to be targeted to something new. So much of the groundwork of knowing that process of having the business plan in place is in place, but earlier companies that don't have that fully developed will go for a phase 1. In a fast track, there are specific milestones between phase 1 and phase 2 that must be achieved before the funding of phase 2 is released. And these phases are not to be confused with clinical trial phases. So how much money can you request? The Small Business Administration, SBA, sets the cap for SBIRs. So it's about $300,000 for phase 1 and over $2 million for phase 2. But this year, one of the major changes we mentioned earlier is that most institutes have increased budgets for specific topics. So it's important to know which topic qualifies, and that will vary by the institute and their specific priorities. To find your budget, you would check the solicitation, also called program announcement or notice of funding opportunity. These terms are used interchangeably. And see the listed phase 1 and phase 2 budget as seen here on the slide. And then you would check the SBA website, the link here is below, for the list of topics that are eligible for that increased budget. Some budgets are increased per year, so you can have more time to do the work and more budget per year. Some are just an overall higher cap, so it's important to check. So when you know your budget, you're now ready to move forward and prepare your application. First things first, before you submit, there's a step of getting registrations in place on the submission portal. So it's not as an exciting step as writing an application, but without it, you can't submit. And it does take some time to process. So the first takeaway for anyone planning to submit in the upcoming cycle is getting your company registered now. The registration steps are, so once your company is incorporated, you would register in the System for Award Management, SAM, ERA Commons, grants.gov, and SBIR.gov, and that's specifically for SBIRs. Once you have registrations in place, you've submitted, you're ready to begin writing or thinking of writing your application. For any SBIR and non-dilutive funding application in general, you would start with a backbone, knowing what are the specific aims you are looking to achieve. So we talked about that the funding supports specific research activities, and you need to show the reviewers you have those activities planned and you have quantifiable milestones. And we know we can't predict science, but you can define what will count as an acceptable outcome. And if that outcome doesn't come to fruition, what will be your plan B? Maybe C and maybe D. So having that thought process in place is what will make your application and plans more compelling. So once you have your initial strategy in place for writing the aims of your grant, you're ready to put together the application. And every successful grant applications, SBIRs included, rests on three pillars. One is who, two is where, and three what. So who is your team? Reviewers see many applications and you need to convince them that you have the right team with the right expertise. The PI, any research assistants, any advisors. Where's the environment, the facilities, the labs, the CROs you are using, and the science itself, most importantly. You have a compelling background, compelling innovation section, a strong commercialization story, and well-designed experiments. Once the application is submitted, it typically takes 6 to 9 months from submission to the notice of award with the process of review in the interim. In order to write a successful application, the best is to write through the reviewer's eyes, meaning taking a closer look from the reviewer's perspective, the questions they'll be asking themselves as they read your application. In the notice of funding opportunity and each solicitation, it lays out in more detail all the different questions that will be asked under each section. But let's take a brief look here. So every application has core criteria, and SBIRs have an additional one, which is commercialization. But we'll start at the core, which is the approach. The approach, the core of your application, that is where you lay out your experiments. What will you be using the money you receive? The plan of execution, any contingency plans, and of course, the specific aims of the research. The aims should ideally not be dependent one on another. So if one doesn't go as planned, it doesn't derail the whole projects, but sometimes dependency is unavoidable. So in which case, rigorous backup plans are essential. Significance. Significance is you want to show that this will fill an unmet medical need. And this ties into the mission of the NIH and your specific institute. What's the background? How many people are affected? And make a strong case for the impact. Innovation. NIH cares about bringing something new. You don't have to reinvent everything, but do highlight what's unique in your approach. Is it a new method? Is it your IP? Is it looking at something from a different perspective, different angle, and making sure to convey that message to reviewers? Some supporting elements, the leadership and environment, as we discussed, are critical for SBIR so they can see who will be doing the research and where. And commercialization. So phase 2 and fast track applications require a dedicated 12-page commercialization plan I mentioned, and that covers the full pathway to the market. But even in the case of phase 1, it helps to weave in some market awareness early. So as you think about writing your application, remember, SBIR funding is real money on the table to fund science, to help companies scale, and to advance your pipeline and assets. And that's through real non-dilutive funding. It stretches way beyond the dollar because every award you win is a stamp of approval from the government that signals credibility to future investors. To recap the path forward, get your registrations in place, target the right institute and funder, NIH, NSF, or others. Determine SBIR versus STTR, phase 1, phase 2, or fast track. Line up your team, environment, and experiments. Submit and review. On the review, so 3 professional reviewers assess your application on the science, strategy, environment, the criteria we mentioned in the slide earlier. 2 tips when reading reviews. 1, looking for consistency. If all 3 reviewers flag the same issue, pay close attention. And 2, look at the gaps between the score and the comments. Sometimes a great score comes with some critiques that clearly didn't hurt much, and other times a modest score comes with only minor comments, which tell you those points mattered a lot. This helps you prepare a strong resubmission. And most successful applicants don't rely just on one submission. They build a portfolio of applications across multiple funders and stages of R&D, and that's exactly what Freeminds helps companies do. To build that strategy, to target the right institutes, shape strong applications, and set you up to win awards. Thank you all for joining today, and best of luck with your SBIR application.